This is Tanya Stansel with Health Education Services. We will be discussing endometriosis. First, a disclaimer. This video is solely for educational purposes. It is not meant to treat or diagnose any condition. Endometriosis is a condition that affects the female reproductive system. It is estimated that up to 10% of women between the ages of 15 and 44 suffer from endometriosis. Typically, every month, the endometrium lines the uterus in preparation for a potential pregnancy or a fertilized egg. If a fertilized egg does not implant into the endometrium, then it is broken down and shed during a woman's menses or her monthly period. In the case of endometriosis, the endometrium grows outside the uterus and can involve the ovaries, fallopian tubes, or the pelvis. Regardless of whether inside or outside the uterus, the endometrium is broken down each month. When inside the uterus, the endometrium exits the uterus through the cervix and the vagina. With endometriosis, there is no exit point for the endometrium and therefore it is trapped. This can cause tissues to become irritated and therefore scar tissue or adhesions may develop. Adhesions occur when fibrous tissues create bands that cause organs and tissues to stick together. The cause of endometriosis has not conclusively been determined. Some possible causes are retrograde menstruation, where menstrual blood flows backward through the fallopian tubes, transformation of peritoneal cells, where hormonal factors cause peritoneal cells to transform into endometrial cells, embryonic cell transformation, where hormones cause embryonic cells, which are present in early development, to transform into endometrial like cells and to implant into the pelvis during puberty, surgical scar implantation, where endometrial cells may attach to a surgical scar after surgeries such as a cesarean section, endometrial cell transport, where endometrial cells are transported through blood vessels or the lymphatic system, or direct transplantation, where after an abdominal surgery, endometrial cells may attach themselves to other parts of the body. Locations that endometriosis can occur include fallopian tubes, ovaries, the vagina, peritoneum, bladder and ureters, intestines, the rectum, or the diaphragm. There are several risk factors for endometriosis, including age, family history, race, having never given birth, an early age of menarche, which is the start of the period, typically before 11 years old, going through menopause at an older age, short menstrual cycles, heavy menstrual cycles, having high levels of estrogen, low BMI, having one or more relatives with endometriosis, or other reproductive tract disorders. A few things that can reduce the risk of endometriosis include pregnancy, breastfeeding, maintaining a healthy weight, and a menstrual cycle that starts at a later age. Signs and symptoms of endometriosis include painful menstrual cramps, abdominal or back pain during or between periods, pain during sex, heavy bleeding during the period, spotting between periods, infertility, bloating, lower back pain, painful bowel movements, diarrhea, constipation, and nausea. There are several tools used to diagnose endometriosis, including a medical history, a physical exam, including a pelvic exam. A procedure that can provide a definite diagnosis is a laparoscopy, where a thin tube that has a camera attached to the end is inserted through a small insertion and is used to remove any suspicious tissue. Other tests that may be helpful include an ultrasound, which creates an image of internal organs, a CT scan, which creates images of successful planes of the body, and an MRI, which creates a two-dimensional view of internal organs. Treatments for endometriosis include medications or surgery. NSAIDs can be used for pain relief. Hormone therapy can be used to reduce or eliminate pain through slowing the growth of the endometrial lining and preventing implantation of endometrial tissue. Hormone therapy can be used to reduce or eliminate pain through slowing the growth of the endometrial lining and preventing implantation of endometrial tissue. Hormonal contraception can control the hormones involved in endometrial tissue building up. Gonadotropin releasing hormone agonists and antagonists are drugs that block ovarian stimulating hormones from being produced. With these drugs, endometrial tissue can shrink. Progestin therapy can relieve the signs and symptoms by halting periods and halting endometrial implants from growing. Therapies may be delivered through intrauterine devices, implants, or injections. Aromatase inhibitors reduce estrogen. With surgery, endometriosis implants can be removed either laparoscopically or abdominally. A hysterectomy to include the ovaries may be done as well. With fertility treatment, a range of things can be done from ovary stimulation in order to produce eggs to in vitro fertilization. Thank you for watching our video. Please subscribe below and visit our blog at healthylivingforyourself.blogspot.com.